Live, I'm Josh Fenton, CEO and co-founder. Want to thank Jamie Segui Rodriguez, the force behind the parents organization Stop the Wait, who has become a major educational powerhouse up at the Rhode Island State House, mobilizing hundreds and hundreds of parents in Providence and the urban corridor, advocating for better schools and specifically advocating for more public charter school seats in Rhode Island. I want to go to Dr. Phil Chan. We've known Dr. Phil Chan in a number of hats, and he is one of the top emerging healthcare experts in Rhode Island. Dr. Chan, thank you so much for joining us.
Thank you, Josh. I'm glad to be here.
Okay, so one of the bills that is topical right now up at the Rhode Island General Assembly is a proposed tax on sugary beverages, and we've had a number of advocates talk about it. And I also want to make the editors know we've invited the beverage industry to provide us with guests. They're the leading lobbying effort against this proposed tax. Give us the overview of the tax and why you as a physician think this is an important public policy issue.
Yeah, so thanks again, Josh, for inviting me. I think, this is an issue that is near and dear to my heart personally. I think I've done a lot of work in the state related to COVID, HIV, STDs, sexual health, LGBTQ plus health in general. But this is another issue that is really of critical public health relevance. And the idea here is a tax for sugar-sweetened beverages. So we're thinking things like soda, essentially, et cetera. And as most people know, processed sugar and some of these beverages are the leading source of sugar in the American diet and really contribute to obesity, and especially among children, especially.
Yeah, and we've tracked the numbers. Rhode Island's got one of the highest obesity rates in the country, and we're matching up with states like Mississippi and Arkansas, not usually our peer group. Generally, Rhode Island does well for childhood health. Obesity is one of those categories where we don't do very well.
It's really striking, actually. It's one of those, in my mind, it's one of these chronic preventable health conditions that is totally preventative. It's obesity in general. And the numbers are striking. If you look across the U.S. as a whole, 42% of adults are obese, and among children, it's about 20%. 20% of children and adolescents 2 to 19. And I believe a large part of that, we know a large part of that, is due to these processed sugars that are in our diet.
And the cost to the healthcare system, the cost to the taxpayer over the course of that child becoming obese at a young age, the data shows they don't reverse that. They don't generally become, they don't generally become healthy adults. That's a lifetime of health implications and healthcare costs to them and to all of us.
Yeah, it's interesting. Obesity, having enlarged waist sizes is it's a risk factor for so many different chronic health conditions. The one, of course, foremost that comes to mind is diabetes. Diabetes is associated with an incredible number of health conditions, heart disease, strokes, neuropathy. I'm thinking about my grandfather who had diabetes for a long time, that had leg amputations. But just, the incredible cost of obesity and the health conditions specifically, like diabetes, heart disease, neurological disease that lead to that.
And the tax is estimated to generate about $35 million. Those dollars would go into a restricted account and then be shifted over to what was once called food stamps, now no longer, and go into the SNAP program to enhance and discount for better nutrition, more vegetables, more fruit, et cetera. What would that seismic shift look like if this bill ever does pass?
And that, Josh, is really the win-win of this situation. So on one hand, you're encouraging people to stay away from sugar-sweetened beverages. So that's a win from the health standpoint. On the other hand, you have the reinvestment of the proceeds from this tax being reinvested, as you mentioned, to SNAP incentives or providing food for people that may not be able to afford. And importantly, these SNAP incentives are reinvested into healthy food, so fruits, vegetables, produce, etc. So it's really a win-win. It's addressing in some part the obesity epidemic, and then it's also addressing access to fresh fruits and vegetables. And of course, that's a win-win, and especially focused on people that may not be able to afford it. So you're improving access for parts of our state for folks that may not be able to afford it otherwise.
Yeah, I mean, listen, branded in my brain is the food bank study that showed that hunger in Rhode Island is at the highest level since the Great Depression. The pandemic, as we all know, the pandemic took whatever our weaknesses were in our society and exposed them multi-times over. Hunger was a problem for, upwards of 20% of the state's population prior to the pandemic. That number has only exploded upward. You're in the front line, you see patients. It seems impossible that in 2021 we could have a hunger issue in Rhode Island at the level that we have it. Talk a little bit about what your experience is and how significant it is from your standpoint.
So from my standpoint, it's a two-part problem. One is the lack of food, so hunger in general. And on the other hand as well, it's also lack of healthy food. And I think per the point about processed sugars, sugars in general, et cetera, that's part of the problem as well. So you have people who can't afford healthy food, and therefore they're going to fast food or other unhealthy food sources. So it's about addressing hunger for sure. And it's also about addressing the need for healthy food, et cetera. And I'm lucky. I can afford to shop at supermarkets, at places, and of course buy fruits and vegetables. But that's not the same thing for every Rhode Islander. And I'm just reminded, of course, as you mentioned during the pandemic, is that so many people have struggled. And I think especially during this time, especially as we come out of the pandemic, it's really a time to double down on health. And as we know, one's physical health is very closely related to mental health as well. And so as we talk about diet, that's part of it. And of course, exercise and other healthy habits as well.
I always think of University Heights shopping area, juxtapose the two, and there's a Whole Foods there and a McDonald's. And the price comparison of going to have lunch, I've eaten in both and had lunch at both. I can go and eat and fill my stomach for $6 at McDonald's. You can barely fill your stomach at Whole Foods for $20. And I have the ability to choose. I have the dollars to choose, as you make the point. For some folks, what's the point of going to Whole Foods? I can't eat enough spinach, which is about the only thing I can afford there. We've got to balance out this access to affordable nutritional food.
It's so true. I mean, Whole Foods can perhaps empty your wallet, but I do admit that I do shop there from time to time. But I think the striking stat, if you just think about it, is just the obesity percentage of Americans. Over 40% of Americans are not just overweight, mind you, but fall into this category of obesity, which is a significant risk factor for all these other chronic health conditions. So 42% per the CDC. I mean, that is, that's higher than anything else I can think of at the moment. So, so things like this tax and other approaches and initiatives are urgently needed to address this.
You also were in the front line and dealing with COVID. Let's talk about that. Those who are obese were much more susceptible to longer stays in the hospital, ICUs, ventilators, and death at younger ages.
Exactly, and in fact, I'm reminded as you're talking that I had worked with Dr. Milanakis, who's chief of ID over at the Brown system, and he and I and a couple others actually wrote one of the first papers, if you look it up online, looking at obesity as a risk factor for more severe COVID-19. And so actually the first evidence of that was done right here in the state of Rhode Island under the oversight there of Dr. Milanakis. So, and it's been replicated now multiple times. So obesity is not just a risk factor for heart disease, strokes, et cetera. It's also a risk factor for a lot of infections, including COVID-19. It's just that when the extra weight just it leads to to just such increased risks, and your body's ability to fight off different infections and just be susceptible to these different diseases.
Dr. Chan, legislators who are still debating this, governor staff who are listening in on this, the governor who might be thinking about it, what's your message to them about specifically, listen, a small tax on specific sugary things, we know it's worked, high taxes have worked well on more so than anything else, not healthcare messages about smoking, it's been increased taxes on cigarettes that has pushed down smoking participation. What's your message to them?
So my message is going to be the same as this for many other things, is that we need to focus on the data and the science and the evidence. And look, I don't always have the right answers for sure. I just know that we have to have a discussion here in our state, across the country, here in our state, about how to address obesity and how to address consumption of sugar. And I think part of it is this tax. And I just hope that as democracy plays out, as we have these discussions, that people do focus on what the data and the evidence and the science shows. And we know from prior experience that this tax has been enacted in other cities and towns, and that people's consumption of soda has fallen. And so I would just caution people to pay attention to the data, the facts, and not per se by corporate industry, which may be making money off some of these products. So we just need to focus on what we need to do, what we should do for Rhode Islanders without having the influence of money.
Dr. Philip Chan, thank you so much, as always. The last time you were on was around March 7th of 2020. It was about a week or so before the first case, maybe a week after the very first case. I think it was March 1st. You were on March 7th, and we're kicking off really in-depth discussions about the coronavirus. For everybody, stay tuned for much more. Listen, if you haven't gotten vaccinated, please do so. It's easy, it's free, it's a jab in the arm. 2 weeks later, you get another one. 3 weeks later, you get another one. Or you can hunt down a Johnson & Johnson and you're one and done. Everybody be healthy. Get vaccinated before these nasty alpha and gamma variants come knocking on our door. And let's keep the economy going and everybody healthy. Thanks, everyone.